So our first speaker today is Dr. Barth from Dartmouth. He is the chief of general surgery and has done a lot of really interesting research and important research on how to establish prescribing guidelines. Dr. Barth.
Well, thank you very much, Jennifer, for inviting me to present some of the work we've done and some of our perspectives. Our charge today is identify general surgical procedures in most need of opioid prescribing. Currently, the vast majority of patients are being given opioid prescriptions after general surgical procedures. If you look at sort of 3 or 4 studies, recent studies, both at Michigan, Mayo, and some studies we've done at Dartmouth, approximately 90% of patients that are having general surgical procedures are being prescribed opioids. So I think to address the charge for this committee then, we really need to look at opioid use by patients rather than whether they're just being prescribed. And specifically, we can ask the question, are there some groups of patients who do not use opioids after general surgical procedures and therefore don't need any to be prescribed to them? So I'm going to break this out into outpatient, general surgical procedures, patients who have been in the hospital for a day, and then others have been in the hospital for 2 or more days. So this table just looks at outpatients, so people who are having very common outpatient operations like partial mastectomies with sentinel node excisions, mastectomies, laparoscopic cholecystectomies, lap inguinal hernia repairs, or open inguinal hernia repairs. And what this table shows is 3 studies, and it looks at the percentage of patients who actually took opioids at home. And you can see that after all these operations, between 50 and 75% or so of patients ended up taking opioids. So I think it's probably fair to conclude then that these patients should be prescribed opioids. It's important to note that some general surgical operations that I didn't put on this table, so for example, partial mastectomies, for example, thyroid and parathyroid surgery. So at least there's evidence for both of those that very few, probably 20% or less of patients actually end up using opioids at home after those operations. Patients who are admitted overnight after surgery, so operations including laparoscopic operations on the stomach, like Nissen fundoplications, laparoscopic appendectomies, and then lap prostatectomies I added in there, even though I'm not a urologist, but there's pretty good data on that. And again, the percentage of patients that use opioids at home after those operations are in the 50 to 75% range. So I think it's fair to conclude that these patients should be prescribed opioids as well. The other patient group that we've looked at are patients who have been admitted for at least 2 nights or in the hospital for a couple of days. And the question is, well, how many opioids should we send them home on? And so we studied close to 200 patients who were admitted after general surgical procedures, including those on the stomach, liver, pancreas, colon or rectum, large abdominal wall hernias. And the question we focused on is, well, how many opioids they take the day before they were discharged? And we focused on that because it takes into account a lot. It takes into account sort of the amount of pain they're having from the surgery. It also takes into account their individual pain thresholds, whether they're smokers or they're not smokers, or all the characteristics that might determine how much opioid someone's going to take when they're home. It takes this metric takes this into account. And what we found then, if any pills were used the day prior to discharge, well then 3/4 of those patients used opioids at home. And if they only used 1 to 3 pills, and a pill is a 5 milligram oxycodone equivalent, then 65% used opioids at home. If they took 4 or more, then 88% used opioids at home. So I think we could pretty safely conclude that these patients should be prescribed opioids. On the other hand, if no pills were used the day prior to discharge, then only 15% of these patients used opioids at home. It didn't matter what operation it was. So I think we conclude that these patients should probably not be prescribed opioids. So in summary, there are some patient groups I think that should not be prescribed opioids, those patients that aren't using any the day before they're going home. There are other operations where there is some data in the literature also with neck surgery, with just partial mastectomies, where I think those patients should not be prescribed opioids. And then I gave you a list of other operations, including lap hernia repairs, open hernia repairs, lap choles, mastectomies, and some laparoscopic appendectomies where patients should be given some opioids at the time of discharge. Thank you.